There is a reason so many people over 60 leave a kidney appointment with a new prescription, a printout of lab numbers, and almost no idea what to eat at 3 o'clock in the afternoon. It is not because food does not matter. It is because food takes time to explain, and time is the one thing most medical visits do not have enough of. A kidney appointment can be over almost as soon as it begins. There is time to mention your blood pressure, time to review your creatinine, time to renew a medication, sometimes time to mention your GFR. But the quiet, practical conversation about what snack choices may actually make life easier on your kidneys, that is often the first thing to disappear. And that is unfortunate, because for many people, those small daily choices are one of the only parts of this process that still feel like they belong to them. I'm Dr. Sophie Hale, and after years of caring for adults in their 60s, 70s, and beyond, I can tell you this: one of the most painful things about rising creatinine is not just the number itself, it is the feeling that the number is climbing and you have no real way to participate in slowing it down. But you do have a role. And today I want to give you 5 simple snacks that are often overlooked, rarely explained well, and in the right situation may help reduce some of the day-to-day strain on your kidneys. Let me be very clear before we go any further, because people deserve honesty, especially when it comes to their health. I am not going to tell you these foods cure kidney disease. They do not. I am not going to tell you they reverse years of damage. They do not. And I am not going to tell you that if your creatinine is elevated, one snack is going to magically bring it back to normal by next week. That would not be responsible. What I am telling you is something quieter and much more useful. When kidney function is beginning to decline, the food you choose can influence how much waste your kidneys have to handle, how much sodium and phosphorus you are piling into a system that may already be struggling, and how much inflammatory stress the tiny filters in your kidneys are dealing with day after day. That matters. That matters. If your creatinine has been creeping upward, if someone has mentioned stage 2, stage 3, or even stage 4 chronic kidney disease, if you are waking up multiple times at night to urinate, or if your lab reports are starting to feel like a language no one has fully translated for you, this is exactly the kind of conversation worth having. Here is where we are going. First, I am going to explain in plain English what creatinine actually is and why it rises. Then I will walk you through 5 snacks, one by one, and for each one I will tell you 3 things: why it may help, how to prepare it properly, and what mistake turns it from helpful into unhelpful. Because with kidney nutrition, the details matter more than people think. So let's start with the number itself. Creatinine is a waste product. Your body produces it naturally every day as your muscles use energy. In a healthy system, your kidneys filter creatinine out of your blood and send it into your urine. That process happens through millions of tiny filtering units called nephrons. When those filters are damaged over time by high blood pressure, diabetes, vascular disease, inflammation, or the slow march of chronic kidney disease, creatinine is not cleared as efficiently. It begins to build up in the bloodstream. That is when your lab report starts showing numbers that drift upward. So yes, creatinine is partly a reflection of kidney function, but here is the part that many people are never told clearly enough. A rising creatinine is not just about past damage, it is also influenced by the workload you continue placing on the kidneys now. And from a practical point of view, that workload is shaped every day by things like sodium, excess protein from the wrong sources, dehydration, highly processed foods, high phosphorus additives, and large amounts of potassium in people whose kidneys can no longer regulate it well. That is why snacks matter. Not because snacks are magic, because they are repetitive. They happen every day, and repeated choices either support your kidneys or quietly push against them. The first snack is one most people do not think of as a kidney food at all. Red grapes. Now right away, I know what some people are thinking. Grapes are sweet. They contain sugar. And if you are trying to manage blood sugar, sweet foods can feel suspicious. That is a fair concern, but portion matters, and so does context. Red grapes contain natural plant compounds, including resveratrol and anthocyanins, which are associated with antioxidant activity. In plain language, they may help reduce some of the oxidative stress that contributes to wear and tear in blood vessels and tissues, including the tissues that support kidney function. They are also one of the more practical fruit options for many people with kidney concerns because a modest serving is relatively manageable in potassium compared with some other fruits that are commonly recommended in general healthy eating advice. That difference matters, especially if you have been told to watch potassium. The best way to eat them is simple: fresh, whole, and cold. About half a cup, roughly 15 grapes, is a reasonable snack-sized portion for many people. Wash them well, keep them in the refrigerator, and if you want to make them more blood sugar friendly, pair them with a small amount of protein or fat, such as a few unsalted macadamia nuts or walnuts if they fit your renal plan. Now here are the mistakes. Do not swap grapes for grape juice. Juice removes the fiber and delivers the sugar faster. And do not assume raisins are the same food. They are not. Drying fruit concentrates minerals and sugar in a much smaller volume. A small amount of raisins can create a very different mineral load than a small serving of fresh grapes. Whole grapes are the key idea here, not grape products. The second snack is one of the smartest protein choices for many older adults with kidney concerns: egg whites. This matters because protein advice in kidney disease is often misunderstood in both directions. Some people hear "be careful with protein" and become afraid of it altogether. Others ignore the conversation completely and keep eating large amounts of processed meats, salty deli foods, and oversized protein portions that place extra burden on the kidneys. Neither extreme is ideal. As we get older, preserving muscle becomes important. Weakness, loss of muscle mass, balance problems, and falls are real threats after 60. At the same time, kidneys that are under strain do better when protein is chosen carefully and not overloaded. Egg whites are useful because they provide high-quality protein with much less phosphorus than whole eggs. The yolk contains most of the phosphorus. The white gives you protein with a lower phosphorus burden, and that can be a meaningful advantage in people who have been told to watch phosphorus levels. They are also versatile, inexpensive, and easy to digest. A practical portion is 3 to 4 egg whites, either gently scrambled in a small amount of olive oil or hard-boiled and separated from the yolk. Add flavor with parsley, chives, black pepper, or a squeeze of lemon rather than salt. If you buy liquid egg whites in a carton, read the label carefully. Some products are much higher in sodium than people realize. The biggest mistake I see is this: people eat one egg white and think they have had a protein snack. That is usually not enough to do much for satiety or muscle support. A more meaningful portion tends to be 3 or more whites, depending on your needs and what your clinician has advised. One caution here: if you have more advanced kidney disease, especially late stage 4 or stage 5, protein goals may need to be individualized. That is where your nephrologist or renal dietitian should guide you. But for many people, egg whites are one of the cleanest protein choices they can make. Now the third snack is the one that surprises almost everyone: potatoes. Not just any potato, a properly prepared potato. Most kidney handouts tell people to avoid potatoes because they are high in potassium, and that concern is real. But what often gets left out is that potassium is water-soluble. That means some of it can be removed through preparation. This process is often called leaching. Here is how to do it properly. Peel the potato, slice it thinly. Place the slices in warm water and soak them for several hours. Change the water at least once, then drain, rinse, and boil the slices in fresh, unsalted water. That is not a gimmick. That is the method. Does it remove all the potassium? No. Does it turn potatoes into an unlimited food? Absolutely not. But it can reduce the potassium enough that a modest serving may fit into the diet of some people, particularly those with earlier stage chronic kidney disease who have been told they can include carefully prepared potatoes in measured amounts. And that matters, because one of the reasons people abandon kidney diets is not rebellion, it is fatigue. They become tired of cold, bland, unsatisfying food and eventually stop trying. A warm, soft, comforting food that still fits their plan can make compliance more realistic. After leaching and boiling, you can lightly mash the potato with a drizzle of olive oil, chopped rosemary, and a little lemon juice. Keep the serving modest, about half a cup. Now the mistakes. Do not microwave a whole potato and assume it is the same thing. Microwaving cooks it, but it does not remove potassium the way soaking and boiling can. And do not automatically replace it with sweet potato, because someone said sweet potatoes are healthier. Healthier for whom is always the question. Sweet potatoes can carry a heavier potassium load, which may not be the better choice for a person with kidney issues. General healthy eating advice and kidney-specific advice are not always identical. If this is helping you so far, this is exactly the kind of topic people wish somebody had explained to them years earlier. And if you know your recent creatinine or GFR, it can be useful to keep track of it and actually understand what those numbers mean in the context of your daily habits. Now let's move to the fourth snack: cauliflower. Cauliflower is not glamorous. It does not sound exciting. It is rarely advertised as some superfood miracle. That is exactly why it gets overlooked. For kidney-friendly eating, cauliflower has several advantages. It is naturally lower in potassium than many starchy side foods. It is also low in sodium unless someone has done something unfortunate to it in a package. And it provides fiber, vitamin C, folate, and plant compounds found in cruciferous vegetables. Why does that matter? Because kidney disease is not just a plumbing problem. It is also an inflammation problem and a blood vessel problem. The same processes that damage the kidneys often damage the vascular system more broadly. Foods that support a lower inflammatory eating pattern can be helpful as part of the bigger picture, especially when they replace heavily processed snack foods loaded with sodium, additives, and refined starch. Cauliflower is useful partly because of what it contains, but also because of what it replaces. It can become a warm snack that does not hit the kidneys with a wave of sodium, phosphate additives, or excessive potassium. One easy preparation is cauliflower rice. Pulse florets in a food processor until they resemble rice, then cook them briefly and finish with olive oil, lemon juice, and herbs. Another option is roasted cauliflower. Toss plain florets with a small amount of olive oil and roast until the edges are golden. Add garlic powder, paprika, or pepper if those fit your plan. It becomes warm, savory, and much more satisfying than people expect. The mistake here is not the cauliflower itself, it is what gets done to it. Frozen cauliflower covered in cheese sauce, creamy packaged blends, heavily salted seasoning packets, and processed side dishes can turn a helpful vegetable into a sodium and additive delivery system. Plain is your friend, season it yourself. The fifth and final snack is one that many people with kidney concerns assume is completely off-limits: macadamia nuts. Now I want to be careful here, because this is where blanket advice causes confusion. Many nuts are relatively high in potassium and phosphorus, so when people hear nuts can be a problem, they often conclude that all nuts are the same. They are not. Macadamia nuts tend to be lower in potassium and phosphorus than many other commonly eaten nuts, and they are rich in monounsaturated fats. Those are the same kinds of fats people talk about when they praise olive oil and Mediterranean-style eating. Why does that matter to the kidneys? Because the kidneys rely on healthy blood vessels. The vascular system and the kidneys are deeply connected. When blood vessels are inflamed, stiff, or damaged, kidney tissue suffers too. A snack that is lower in sodium, lower in phosphorus than many alternatives, and supportive of a heart-healthier pattern can be useful for the right person in the right portion. And portion matters a lot here. Macadamia nuts are calorie-dense. You do not eat them by the bowl. A practical serving is about 10 to 12 nuts. Measure them out. Do not snack directly from a large bag. Choose raw or dry-roasted, unsalted versions whenever possible. Avoid sweetened, chocolate-covered, caramel-coated, or heavily salted varieties, and check the label for phosphate additives, because that is where many packaged foods quietly become kidney-unfriendly. One of the simplest snack combinations on this list is this: a small serving of macadamia nuts with a few fresh red grapes. It is satisfying, easy, and far more kidney-conscious than the processed crackers, chips, or deli snacks many people reach for automatically. One quick side note: if you have a dog in the house, keep macadamia nuts away from pets. They are not safe for dogs. Now I want to tell you about the kind of patient who sits at the center of a conversation like this. I will call him Martin. Martin was 68 when he first came in, deeply worried about his labs but strangely disconnected from them at the same time. He could recite his creatinine from memory because it frightened him, but no one had ever really explained to him how daily food choices could support the work his medications were already trying to do. He was taking his prescriptions, he was attending his appointments, he was doing his best. But his snacks looked like what a lot of people's snacks look like when they have never had this conversation. Crackers, processed cheese, deli meat, sweetened yogurt, the occasional banana because he thought bananas were universally healthy, and convenience foods he assumed were harmless because they were small. He also told me he was up 2 or 3 times a night to urinate, and he had started feeling as if his body was becoming something he observed rather than something he could influence. That feeling is heavier than many people realize. So we made small changes, not dramatic ones. He kept following the treatment plan from his kidney specialist. That did not change. But between meals, he began replacing some of the processed snack foods with simpler, more kidney-conscious choices. Fresh grapes instead of juice, egg whites instead of salty deli meat, measured portions of macadamia nuts instead of mixed salted nuts, cauliflower in place of some processed side foods, and yes, a carefully leached potato once in a while instead of assuming potatoes were forbidden forever. What happened? Not a miracle. That is the important part. His kidneys did not become 30 years younger, his numbers did not suddenly become normal, but over time he felt better fed, less deprived, more in control, and more aware of the difference between a food that was merely convenient and a food that genuinely fit the situation his body was in. That matters, because the goal is not fantasy, the goal is traction. So let me pull the whole picture together for you. These 5 snacks are not powerful because they are trendy. They are powerful because they work on the same few principles again and again. They reduce unnecessary sodium. They avoid loading the body with highly processed phosphorus additives. They provide smarter portions. They support a lower inflammatory pattern of eating. They may reduce the amount of waste, mineral burden, or vascular stress your kidneys are dealing with. And they are realistic enough that someone can actually buy them, prepare them, and repeat them. That last point is important. The best kidney advice in the world is useless if nobody can live with it. So what should you do first? Tonight or the next time you go to the store, make a short list: fresh red grapes, eggs or liquid egg whites, plain cauliflower, a couple of potatoes if your clinician says they fit your plan, and a small bag of raw or unsalted macadamia nuts. Then pick one snack. Just one. Do not try to change your entire diet by tomorrow morning. That is how people overwhelm themselves and quit. Replace one usual snack with one better choice. Learn the potato method properly if potatoes are allowed for you. Start reading labels for sodium and phosphate additives. And keep your follow-up appointments because none of this replaces your lab work. You still need to know your creatinine, your GFR, your potassium, your phosphorus, your blood pressure, and your blood sugar. Food is support. It is not a substitute for care. And I want to end with the caution that matters most. If you have stage 4 or stage 5 kidney disease, if your potassium has ever run high, if you are on dialysis, or if your nephrologist has given you very specific protein or mineral limits, do not rebuild your diet from a video alone. Take the ideas to your own clinician, or, even better, to a registered renal dietitian, and personalize them. Because the right snack for one person can be the wrong snack for another depending on their labs. But if you take nothing else from this, remember this one thing. A rising creatinine is not always a signal that you are powerless. No, you cannot control everything. But you can reduce some of the unnecessary work your kidneys are being asked to do. And sometimes that starts not with a dramatic overhaul, but with what you reach for between lunch and dinner. A handful of grapes instead of juice, egg whites instead of salty processed protein, a carefully prepared potato instead of assuming comfort food is gone forever, plain cauliflower instead of packaged convenience sides, a measured serving of macadamia nuts instead of whatever came out of the vending machine or pantry without a second thought. Those are small decisions. But small decisions repeated over time are how many people begin participating in their own care again. And that feeling matters more than people think. I'm Dr. Sophie Hale. Take good care of yourself, keep an eye on your numbers, and start with one change this week, not someday. Your kidneys have been working for you every minute of your life. It is worth learning how to work for them too.